Cycling is a beloved sport and mode of transportation for millions, but it comes with unique health risks. One of the most significant is pudendal neuropathy, a nerve disorder caused by compression or injury to the pudendal nerve. This condition can lead to pain, numbness, and even sexual dysfunction, affecting both men and women. Repetitive pressure from the bike saddle, especially during long rides or with improper bike setup, is a key factor. Understanding how this nerve is affected is crucial for cyclists who want to enjoy their sport safely. In this video, we'll explore the causes, diagnosis, and the best strategies to prevent and manage pudendal neuropathy, ensuring you can keep riding with confidence. Pudendal neuropathy often develops from repeated microtrauma or sustained pressure on the perineum, the area between the sit bones during cycling. The pudendal nerve runs through this region and can become compressed between the saddle and the pelvic bones. Factors like a forward-leaning posture, long hours in the saddle, and certain bike setups increase the risk. Symptoms may include sharp pain, tingling, numbness, or even erectile dysfunction. Both novice and experienced cyclists can be affected, and early warning signs should never be ignored. Recognizing these symptoms early is essential for timely intervention and prevention of long-term complications. Hallmark symptoms of pudendal neuropathy in cyclists include pain along the nerve's path, genital numbness, tingling, and sometimes sexual dysfunction. These symptoms can appear during or after cycling and may persist for hours, days, or even longer. In some cases, symptoms resolve with rest, but for others, they can become chronic and disruptive. Both men and women are at risk, though the presentation may differ slightly. Paying attention to any unusual sensations in the perineum or genital area is key. If you notice persistent discomfort, it's important to take action early to prevent worsening of the condition. Diagnosing pudendal neuropathy starts with a thorough clinical evaluation, focusing on the cyclist's history and symptoms. Doctors may use pain scales, questionnaires like the International Index of Erectile Function, and physical exams to assess nerve involvement. In some cases, advanced tests such as nerve conduction studies, electromyography, ultrasound, or MRI are used to confirm the diagnosis and rule out other causes. The NOT criteria developed by experts provide a structured approach for diagnosis. Early and accurate diagnosis is vital for effective treatment and to prevent long-term nerve damage. Design and setup of your bike play a major role in the risk of developing pudendal neuropathy. Hard, narrow, or upward tilted saddles increase pressure on the perineum, while handlebars set too high or too low can alter your posture and add to the risk. Mountain bikes compared to road bikes may also increase the likelihood of nerve compression. For women, saddle shape and handlebar position are especially important, as studies show a link between certain setups and decreased genital sensation. Proper bike fitting and equipment choices are essential preventive steps for all cyclists. Preventing pudendal neuropathy starts with smart cycling habits. Take frequent breaks during long rides, stand on the pedals periodically, and shift your weight to relieve pressure. Adjust your saddle to be soft, wide, and slightly tilted downward, and consider using padded biking shorts for extra comfort. Handlebar height should be set to promote a more upright posture. For those experiencing symptoms, reducing training intensity and allowing time for rest can help. These simple adjustments can make a big difference in reducing nerve compression and keeping you on the road. If symptoms develop, rehabilitation and targeted exercises can aid recovery. Programs often focus on adjusting cycling technique, improving posture, and stretching to relieve nerve pressure. Weight management may also help, as excess weight can worsen compression. Techniques like the active release technique ART involve muscle tension and stretching to relieve nerve entrapment. Most cases improve with conservative measures, but persistent symptoms may require a structured rehabilitation plan under professional guidance. Early intervention is key to a full recovery and a safe return to cycling. Severe or persistent cases, more advanced treatments may be necessary. These can include nerve blocks where medication is injected to relieve pain, or even surgical decompression in rare cases. Some cyclists with acute injuries may require procedures like arterial embolization. Medications such as anti-inflammatories or nerve pain drugs can provide symptom relief, though not all are effective for everyone. Most importantly, these interventions are reserved for cases where conservative measures have failed and should be managed by specialists familiar with cycling-related nerve injuries. Despite growing awareness, more high-quality research is needed to refine diagnostic methods and develop effective evidence-based treatments for pudendal neuropathy in cyclists. New bike designs and preventive tools are emerging, but robust clinical trials are still lacking. Raising awareness among cyclists, coaches, and healthcare providers is essential to promote early recognition and intervention. By staying informed and proactive, cyclists can protect their health and continue enjoying the sport they love. Remember, prevention and timely action are the best strategies for a pain-free cycling experience.